Monkeypox is a viral disease. It's been around for a while, but we're seeing more cases lately. The virus that causes monkeypox is related to smallpox, but it's usually milder. While anyone can get monkeypox, recent outbreaks have mostly affected men who have sex with men. Monkeypox was first discovered in monkeys, hence the name. However, it's important to note that rodents are now considered the primary animal reservoir. This means that humans can get infected through contact with infected animals like squirrels or rats. The good news is that monkeypox is not as contagious as some other viruses, like measles or the flu. It spreads through close contact with an infected person or animal, or with materials contaminated with the virus. Monkeypox is often a self-limiting illness, meaning it usually resolves on its own without treatment. However, it can cause unpleasant symptoms and, in rare cases, lead to complications. Monkeypox typically starts with flu-like symptoms. You might feel feverish, have a headache, or experience muscle aches. Swollen lymph nodes are also common and can be a distinctive feature of monkeypox compared to other similar illnesses. The telltale sign of monkeypox is a rash that develops a few days after the initial symptoms. The rash often starts on the face and then spreads to other parts of the body, including the palms of the hands and soles of the feet. These pox lesions evolve through different stages. They start as flat spots, then become raised bumps filled with clear fluid, and finally, they crust over and scab. The entire process can take several weeks. It's important to remember that not everyone with monkeypox will experience all of these symptoms. Some people may only have a mild rash, while others may have more severe flu-like symptoms. Monkeypox spreads through close contact. This could be skin-to-skin contact with an infected person, particularly contact with the rash. It can also spread through contact with contaminated materials like bedding or clothing. The virus can also spread through respiratory droplets. This means that prolonged face-to-face contact with an infected person could potentially lead to transmission. However, it's important to note that monkeypox is not considered an airborne virus like measles or COVID-19. While monkeypox can spread through sexual contact, it's crucial to understand that it is not classified as a sexually transmitted infection. The close contact involved in sexual activity facilitates transmission, but the virus can spread through any form of close contact, regardless of sexual orientation. Section 4. Prevention is key. Preventing monkeypox involves avoiding close contact with infected individuals and animals. If you know someone who has monkeypox, it's essential to isolate them and avoid physical contact until their rash has completely healed and scabs have fallen off. Good hygiene practices are crucial in preventing the spread of monkeypox. Wash your hands frequently with soap and water, especially after contact with someone who is sick or their belongings. Use an alcohol-based hand sanitizer if soap and water aren't readily available. Avoid sharing personal items like towels, bedding, or clothing with someone who has monkeypox. It's also important to avoid contact with wild animals, particularly rodents, in areas where monkeypox is known to occur. Vaccines like the Jynneos vaccine can provide protection against monkeypox. Talk to your healthcare provider to see if vaccination is right for you, especially if you are at higher risk of exposure. Section 5. Treatment and management. Most cases of monkeypox resolve on their own without specific treatment. The focus is on managing the symptoms and preventing complications. Getting plenty of rest, staying hydrated, and taking over-the-counter pain relievers can help alleviate discomfort. For more severe cases, antiviral medications like tecovirimat, also known as Monkeypox, may be prescribed. These medications can help reduce the severity and duration of the illness. Your doctor will determine if antiviral treatment is necessary based on your individual circumstances. If you develop a rash, it's important to keep it clean and dry to prevent secondary bacterial infections. Your doctor may recommend specific wound care measures. Section 6. Staying informed, staying safe. Monkeypox is a public health concern, but it's important to approach the situation with accurate information and a calm demeanor. By understanding how the virus spreads, recognizing the symptoms, and taking appropriate preventive measures, we can effectively limit its transmission. Stay informed about the latest developments and recommendations from reputable sources like the Centers for Disease Control and Prevention, or CDC, and the World Health Organization, WHO. They provide up-to-date information and guidance on monkeypox. Remember, awareness is key. If you suspect you may have monkeypox, contact your healthcare provider immediately for diagnosis and guidance. Early detection and appropriate care can significantly improve outcomes and help prevent further spread.